When did you witness someone's career end in a single moment? After fracturing my foot while hiking in Portugal, I ended up in the ER of the exact hospital where I performed my first ever surgery. I walked in limping, my face and arms stained with muck, with my clothes torn apart from the fall. Nurse Janet picked up on this immediately and profiled me as a homeless addict without a second thought. Reception had given me a wheelchair, but Janet snatched it away. She declared I didn't need it and could walk just fine. She pointed to the corner seats far from everyone else. An elderly couple arrived 10 minutes later. Janet forced me to move. I didn't understand why, because the couple wasn't even beside me until I stood up and saw Janet making a show of spraying disinfectant on my chair. A few minutes later, I asked if I could use the bathroom to clean up and get the muck off me. Janet said bathrooms were for processed patients only. When she finally sent me to reception for more information, she warned them loudly in Portuguese, which she didn't think I understood, to watch their belongings. Then she called security over and told them to keep an eye on me. After taking 3 patients who arrived after me, she finally called my name. She asked loudly if I was seeking pain medication. The entire waiting room turned to stare. She forced me to stand during the assessment, even though my foot throbbed with each movement. She took my vitals with obvious disgust. After touching me, she used hand sanitizer dramatically, rubbing her hands for 30 seconds. Then she made me hop back to the waiting area without help. She declared I better be able to pay because she didn't deal with my kind for nothing. An hour later, she returned with my forms and dropped them on the floor. She claimed I'd filled them wrong and needed to redo everything. As I bent down, she kicked the papers slightly out of reach. I had to struggle back up and retrieve them while she watched and laughed. A new patient arrived, and that's when she made me give up my seat, the last seat remaining. She told everyone I was faking anyway and could stand. To top it off, I heard her warn the mother beside me to keep her children away from the homeless, possibly predatory man. I hopped up to reception to ask if I'd have to wait much longer to be seen, and Janet intercepted. Instead of letting the receptionist respond, she smugly replied that I had nowhere else to be. She then told me to stop wasting everyone's time with stupid questions and be grateful I hadn't been removed yet. After another hour of standing on one foot, my calf began to cramp so badly. There was no way I could continue to stand, so I asked another nurse for a chair. Janet saw this and retrieved one herself. I thought she was finally being nice to me until she set the chair leg down on my injured foot as I tried to balance myself. I screamed out in pain, yet Janet just insisted I sit immediately. To top it off, as I went to sit, Janet pulled the chair away, leaving me to fall hard on the floor. She then told me to be more careful and walked away, laughing even louder this time. A few more hours passed before I hopped to the water fountain to take some over-the-counter painkillers, since I had been refused any pain medication. That's when Janet ran out screaming that I was taking doc drugs. Security grabbed my arms while Janet loudly declared she's always right about my kind. I tried to explain, but she demanded I prove my injury by jumping. When I refused, she ordered security to drag me out. They pulled me along as I tried hopping on one foot. She shoved me outside and said if I returned, she'd call the police. An ambulance pulled in just as I hit the pavement. The trauma team rushed a gurney past me with a man whose chest was torn open. Blood poured as they shouted about ventricular rupture. I heard Janet panicking as the cardiac surgeon was 30 minutes away when the patient had 20 minutes at most. That's when I limped back through the doors toward the trauma bay. Janet paused what she was doing just to scream at security to stop me. This time, I interrupted her and called out my medical license number, telling her to verify it immediately. Her face went pale. She took her tablet and searched it up, and that's when her jaw dropped. Dr. Jonathan Roford, chief of cardiac surgery. Her tablet crashed to the floor the moment my professional photo appeared on screen. I ignored her shock and told her to prepare the table. She dryly swallowed and did as told, not daring to meet my eyes. The surgical team actually noticed my limp and brought me a specialized stool. I spent the next 14 hours saving this man's life, and when I was finally done, I saw Janet looking at me with tears streaming down her face. I limped out without even looking at her, then asked if now someone could finally come check on my foot. The next morning, the CEO of the hospital called me. He heard about the situation and wanted to apologize about Janet. Then he asked me something off the record, what I thought of Janet. The implication was clear. I told him she was medically negligent and discriminatory. She denied patient care based on appearance, and that endangered lives. Janet was terminated within 2 weeks and has never worked in a hospital since.